Hello guys, hope you all are doing good. Today we are going to discuss about a childhood mental health problem, that is conduct disorder. In the last videos we had a discussion regarding two childhood mental health disorders, that is anxiety disorder and ADHD, that is attention deficit and hyperactivity disorder. Please listen that before going to this one. Okay, so we are going to start the video. So what is conduct disorder? Conduct disorder is also a childhood disorder. You know the meaning of conduct. So problem is coming in the conduct. That is conduct disorder. That is the simple meaning of conduct disorder. While coming to a definition, what is conduct disorder means? Of course, it is a behavior disorder. So it is a type of childhood behavior disorder characterized by antisocial behavior. Antisocial behavior means disregard of basic social rules. Irresponsibility. Delinquent behavior, that means missing schools and skip away from school. Violating the rights of others and committing assaults or rape. So it is a group of behavior disorder like antisocial behavior, irresponsibility, delinquent behavior, violating the rights of others and committing assault or rape. So this behavior disorder is known as conduct disorder. Conduct disorder is also characterized by pushing, hitting, biting, bullying, cruelty, violence in adolescence, drug abuse, etc. etc. So there are a lot of conduct abnormalities we can see in the child depend upon the age. In the childhood we can see like pushing, hitting, biting, etc. While coming to the schools and all, bullying, cruelty. While coming to the adolescence period we can see like violence, drug abuse, low self-esteem, lack of confidence, temper tantrum, like lot of characteristic features we can see in a child with conduct disorder. So the symptoms can be classified into aggressive behavior, destructive behavior, deceitful behavior, and violation of rules. So what is aggressive behavior means? Like these kind of students or people or children are not ready for any kind of compromises in life. For example, fighting for everything, being cruel to others or animals, using weapons, and forcing another into sexual activity. So these kinds of violent activities they will do, and that activities are coming under aggressive behavior. Second thing is destructive behavior. For example, intentional destruction of others' property and vandalism. Next thing is deceitful behavior. That means lying, shoplifting, breaking others' property, stealing, etc. etc. And they will violate the rules. Some norms and rules we need to follow means they'll never follow the rules. So these are all the symptoms we can see in a child with conduct disorder. While coming to the causes, the exact cause of this condition or this disorder is unknown. But there are some risk factors like biological factors. Biological factors include damages or defects in your brain, especially in different part of the brain where our emotions, our activities, our attentions are controlling. So any damages to this part of brain may be a reason behind this conduct disorder. I am telling you that this is not the actual reason, might be this is a reason behind conduct disorder. Another thing is genetic factor. Close family members with psychiatric problems like anxiety disorder, mood disorders will show this conduct disorder. So in your family members, anyone is having any mental disorders, and conduct disorder means that will transfer from generation to generation. Next thing is environmental factors. Environmental factors means the surrounding where you are living or the child is living. Family problems, disturbances in the family, always listening problems, parents divorce, childhood abuse, rape, substance abuse. So discomfortable environment is also acting as a reason behind conduct disorder. Next is psychological factors. Psychological factors is saying that impairment in the thinking. So or your cognitive process is not taking place in a proper way according to the age, according to the development, means there are chances of conduct disorder. Then social factors like low socioeconomic status, peer conflicts, poverty, etc. So if you are in a, or the child in a low socioeconomic status, chance of peer conflicts and poverty is also a reason. So these are all the reasons or the risk factors, and the actual cause of the conduct disorder is unknown. So the children with below mental health conditions or the problems will show conduct disorder. So along with mood and anxiety disorders, we can see conduct disorder. PTSD, that means post-traumatic stress disorder, children or the people will show conduct disorder. Substance abuse, conduct disorder and substance abuses are related to each other. ADHD and conduct disorders are related to each other. Learning disability, the child with learning disability will definitely show the characteristic features of conduct disorders. While coming to the diagnosis, the diagnostic tools are history collection. Proper history collection is very, very important to understand the problem. Physical examination, mental status examination, and neurological examination. So these are all the diagnostic tools which we are using to find out this condition. An expert psychiatric professional is needed to find out this condition. Mental health professional and pediatrician will sit together and will discuss with the child and family, and at last they will come to the conclusion. While coming to the management, major management or treatment modality is therapy. Among the therapies, cognitive behavioral therapy, family therapy, and group therapy are the major therapies which we are using to treat this conduct disorder. CBT, in almost all psychiatric conditions, in almost all videos, I'm telling about the CBT or talk therapy. So talk therapy is playing a major role, or CBT is playing a major role in the treatment of childhood disorder or any mental health disorder. So this CBT or talk therapy will help to change the maladaptive behavior into adaptive behavior, or simply I will tell you negative behavior into positive behavior. And there are different techniques we are using to change this maladaptive behavior into adaptive behavior, and this link will give the information regarding CBT, how the CBT will work. Next thing is family therapy. Family therapy will help to improve the communication skills and family interaction. Family playing a major role in the development of child. Most of the time some children will spend in their family. So family is playing a major role, and family members can sort of lot of problem which is happening in child's life. So when we conduct the family therapy session, or the therapist is conducting the family therapy session, parents sincerely needed to attend the therapy session to develop some changes, to develop some positive behavior in child. And this link will give the information regarding family therapy and the different techniques which we are using in family therapy. Then group therapy. Group therapy means conduct disorder children will sit together. Okay, the children with conduct disorder and that children will sit together, and one child will look into other child's behavior. Okay, so automatically an interpersonal skills and interactions will develop in among children, and that will help the child to change the maladaptive behavior into adaptive behavior. So group therapy is also playing a major role in the treatment of this conduct disorder. Then while coming to the medication, there is no medication officially approved to treat conduct disorder. No medication. But the psychiatrist will prescribe the medication which is prescribing for depression, ADHD and all. But we must be very cautious about the medication because we are dealing with children. So guys, there is no officially accepted or approved medications for this conduct disorder. But if they show aggressive behavior, if they are in a depressed stage, if they are doing over activities like hyperactivities, sometimes the psychiatrist will suggest some very low dose of antidepressant drugs and anxiolytic drugs, but there is no officially approved drug. And one question, whether it can be prevented? Not possible. Not at all. We cannot prevent this condition, but early detection can minimize the distress to the child and family and prevent problems associated with this. So early detection will help to stop it, will reduce the severity of the condition. That's it. But whether it can be prevented like that, a question is asking me, that is not possible. Then helping the child with conduct disorder. How you can help the child with conduct disorder? Early detection and treatment to prevent future problem. That is the first thing. Early detection. Observe the child, talk to the child, interact the child, understand the situation of the child. And early detection, then give treatment to the child to avoid the future problem. Then follow doctor's order as it is, or the psychiatrist orders as it is. Keep all appointments with the healthcare provider. If they give some sessions for cognitive behavior therapy, definitely you need to take your child for the therapy. Sincerely participate in family therapy. As I have told you, family therapy is playing a major role in the treatment of conduct disorder. So sincerely participate in family therapy as needed. Talk to the counselors, therapists, social workers, psychologists, psychiatrists to provide better care. So you need to talk to the healthcare team to understand the situation of the child, to tell others about your child condition, and don't lose the confidence. And if you feel overwhelmed or stressed, talk to the health provider. That's all about this conduct disorder. Hope you understand. Thank you.